4 years ago, Perth mother Erin Berg was released from a Fremantle mental health facility where she was being treated for postnatal depression. Within weeks, she'd taken her own life. Erin Berg's death was followed by a series of other suicides of patients who'd been treated at the same facility, the Alma Street Centre. For years, her family has been looking for answers and have now launched legal action against the health department. But health experts say the problem is not limited to one hospital and warn there are complex challenges associated with discharging mental health patients safely back into the community. Charlotte Hamlin reports.
It stopped us all in our tracks. You know, we knew she was unwell and we so wanted her to get better.
Unfortunately, the depression was so severe by that stage that Erin really didn't accept that anything could be done to help.
It's been 4 years since Erin Berg died. The 39-year-old had fought a lengthy battle with depression. After giving birth to her fourth child, she spent time in Fremantle Hospital's mother-baby unit and was later transferred to the hospital's Alma Street Centre, a psychiatric facility for adults. Her sisters Sally, living in Brisbane, and Stephanie in Perth, say Erin's care at Alma Street was substandard. They've launched legal action against the WA Health Department, claiming staff at Alma Street were negligent, failing to assess and communicate Erin's suicide risk to the family.
We're not after answers, we want accountability.
Erin died after being discharged from Alma Street and travelling to Tijuana, Mexico to source a euthanasia drug commonly used by vets to put down large animals. She'd read about the drug, where to get it and how to administer it in a book on assisted suicide.
One of the worst things for us is how Erin died, because she'd talked to us many times when she was really depressed about wanting to die and feeling like she didn't want to be around and making comments like, if I was a dog you'd put me down. So we knew that that was something that was front and centre of her mind. But the other thing that was front and centre of her mind was not wanting to die what she called a harrowing death. And as things turned out, she died a harrowing death.
In May 2008, Erin took the drug in her Tijuana hotel room in an attempt to commit suicide, but it didn't kill her. Instead, she spent days in a coma in a Mexican public hospital, sharing her ward with gunshot wound victims at a time when the city was the centre of gangland drug wars. Erin had left Australia completely unbeknownst to her family after appearing before the Mental Health Review Board and being discharged from full-time care. However, she was still a supervised patient under the Mental Health Act. As part of their legal argument, her sisters say there was evidence that she was unstable and suicidal, including travel documents on her possession while she was in hospital. They're signs the sisters say were ignored by the health department.
They knew that she had a clear suicide plan, which we did not. They knew that she had a plan to go to Mexico, which we did not. They knew that she had travellers' checks organised, which we did not. When they know all of those things and the person is also still an involuntary patient, which Erin was, for her to still be able to get on a plane and carry out the detailed plan that they knew about says to me that something is lacking.
Death is traumatic, but I think it was doubly horrific in the circumstances in which Erin died.
Phil Gleeson is representing the sisters, Erin's husband and her children in the legal action against WA's health department. They're seeking unspecified damages for economic loss and nervous shock.
We allege that Alma Street failed to do a proper risk assessment and take into consideration the evidence which clearly established a suicidal intention.
Much of the sisters' legal argument is based on the findings of a report into Erin's death by WA's chief psychiatrist. The report was compiled on the condition it not be made public, but the sisters say it reveals a number of failures on the part of the Alma Street Centre and the health department that need to be addressed. There have been 6 suicides of Alma Street patients in the past 12 months.
The proximate nature of all those deaths makes me wonder, like any other member of the community, whether or not there is something systemic going wrong at Alma Street.
From a citizen's point of view, it seems to indicate a problem.
Michelle Koski from the Health Consumer Council says problems arise in mental health cases when it comes to communication between patients and their families.
I think there are some real tensions between the rights of consumers and the rights of families and the rights of carers. If they're members of a family who love their sibling, brother, sister, mother, father, but they're not the prime carer, then the hospital is in really no position without the consumer's consent, and I think that's really important to note, to pass on any information to members of the family as they wouldn't in any other condition.
There was no communication, and I think that is a great injustice to people with mental health issues. I can understand confidentiality, as all my sisters can. However, when someone's at risk of hurting themselves, breaches of confidence are allowed. They're allowed legally under the Privacy Act.
After the recent spate of suicides of Alma Street patients, the Mental Health Minister, Helen Morton, launched a review of the facility's operations. She won't comment on individual cases, but she says 6 deaths within a year is not a standout figure.
I'm being assured that the circumstances at Alma Street are not any different to circumstances at other similar hospitals.
The Minister says construction of a series of transitional units is underway across the state. They're halfway houses designed for patients who leave hospital but aren't quite ready to return to the community. Ms Morton says the units will address some of the difficulties faced by mental health organisations when it comes to assessing risk and discharging patients.
We do inpatient care extremely well, but we don't manage high-risk patients very well in the community. That's an area of development that we're pursuing at the moment.
But she says the reality of depression is that it can kill.
Sometimes, despite all the efforts of people who work in the system, all of the clinical work that's done, all of the support that's available to people in the community, the support that's provided around by family and friends, unfortunately, sometimes people still do die from their mental illness.
We were told that sometimes, in spite of all the best of care, people are intent on hurting themselves. Now, our issue with that comment is that Erin did not receive the best of care.
Sally and Stephanie Doyle say after 4 years of questioning why their sister died, they feel they've been forced to the courts.
One consideration for us is that senior health bureaucrats seem to take a lot more notice of lawyers and possible payouts than they do of considered requests for improvement and change. So from our point of view, it's another avenue that we have to place pressure on them to fix it, because it will cost them. The time for policies, procedures and promises is over. It needs to be fixed. And it needs to be fixed quickly, because the body count is growing and that's not acceptable.